For many women, their period pain is debilitating. They can be curled up, lying in bed, not able to function, not able to go to work, or it might just mean that they need to be planning their life around their periods. Now, if that sounds like you, then I would say it is not normal. There can be lots of causes of women having bad period pain, ranging from just it being a normal variant for them, but sometimes there can be important underlying reasons why women have bad period pain. And I think for so many years, this has been not recognised and not managed appropriately for women, which is really quite sad and disappointing. So I would encourage that if you are having bad periods that are interrupting your life, or if you just feel in here that you're struggling with how intense your periods are, they're not responding to simple analgesics like Panadol and Nurofen, those sorts of things, then you should be talking to your GP and finding out more and having it investigated, because it's important that we can help you that we can investigate possible underlying causes that can be managed. There are some important underlying causes of bad period pain. I guess the most well-known one is something called endometriosis. The average time from when women start experiencing symptoms of endometriosis to the time they're actually diagnosed is often many years, and it shouldn't be the case. I think many women will think that having bad period pain is normal and just a part of life, and never actually have anyone take that next step to talk and find out more a bit about their period pain, how it's affecting their lives, and whether or not they should be having investigations and further management, looking for things like endometriosis. So endometriosis is essentially where the cells, the lining of the womb that bleeds every month, have found their way outside the womb and into the pelvis or anywhere else in the body. And like inside the womb, they bleed every month. And so this bleeding can cause pain, scarring. It can lead to things like chronic pelvic pain, infertility. So there are reasons why we need to investigate and find out if it's endometriosis, because we want to prevent, well, number one, we want to help you with your chronic pelvic pain, but we also want to prevent any future complications that might arise from it. So in answer to your question, is my bad period pain normal? No, it's not. It shouldn't be. And I really feel that women should be taking those steps to have it investigated and at least get a second opinion about it from someone who has an interest in women's health and who's on the lookout for things like endometriosis. I think telehealth is a wonderful way to help women explore their chronic pelvic pain, and often, whether it's just for a second opinion, for women who are rural or remote, they might not even have a GP who can see them, or a GP who has an interest or understanding of chronic pelvic pain and other women's health issues. So I feel that telehealth is a great medium to be able to give access to women to find out more and to be able to help them. Often in medicine, a diagnosis is made 90% from the history, which is a medical word to say, from what you're telling me, 90% of the time we know what's going on before we even think about examining a patient. So if we can do 90% of that via telehealth, that's fantastic. And certainly we can do initial things like getting you to keep diaries, so that helps us to understand a bit more about what your symptoms are. We can organise blood tests, we can arrange ultrasound scans, we can refer to a gynaecologist. So there are a whole lot of things that we can do that don't need to be face-to-face. So definitely, I think it's a great service to be able to offer to women.